joining our Matchmaker session today. My name is Juliana Weber, and I'm the project coordinator for the City of Hamilton. Matchmaker events are where we learn more about the projects that have been submitted by staff members of the city, and we work with our faculty members to find a good student, faculty, and staff partnership to tackle the projects. Today, we are joined by Katrice Carson, Senior Project Manager for Hamilton Public Health. She will be discussing the opioid crisis and the specific needs, experiences, and ongoing barriers to opioid-related care facing the most at risk in our community. So welcome, Katrice, and thank you so much for joining us today. First, if you could tell us about your role at the city and how your work impacts Hamiltonians.
Hi, thanks for having me. My name again is Katrice Carson, and I'm a Senior Project Manager in Public Health Services in the Healthy and Safe Community Department. In the focus of our group is mental health and harm reduction. What that means is that our group focuses on aspects of and support for the 4-pillar approach to substance use in our community and its harms. The 4-pillar approach is prevention and education, harm reduction, social justice, and treatment. Currently, Public Health Services is focusing on our core essential services because we are still very much in COVID-19 pandemic response and vaccine distribution rollout. Some of our core essential services currently are naloxone distribution, harm reduction supply distribution, needle exchange, community sharp spin disposal projects, supports for young families and children, mental health and outreach, treatment programs for alcohol, drugs, and gambling services, the mobile van outreach program, surveillance and reporting of overdose activities. Like many of city initiatives, the Hamilton drug strategy was put on hold when the COVID-19 pandemic response was initiated in early 2020. But as we move into health system recovery and provincial reopening, we recognize that it's vital to start to reassess where we're at and make some meaningful plans to move forward.
That covers a lot. Thank you for submitting the challenge. And I know that health services has been stretched really thin during the pandemic and have had to really reorient how you provide service and how you reach the community. So if you could kind of guide us through the challenge that you've submitted, share some background information and some of the key objectives that you're looking to accomplish.
So what we do know is that opioid use in our community is a complex issue and there's no silver bullet to address it. And that a comprehensive opioid dependence and overdose response plan must increase access to effective treatment, reduce harms, prevent future opioid use, and decrease the role of criminalization and stigma. But while the administration of the drug strategy has been paused since March 2020, Hamilton Public Health Services and many community agencies have continued to offer a wide range of opioid-related harm interventions in our community. Throughout the pandemic response, we've offered harm reduction services and community outreach, mental health supports. There's been engagement of people and programs. There's been diversion programs that are still happening. There's data sharing and there's treatment services that are available. And so even though all of these programs are still happening throughout the community, what we're seeing is that there is still an increasing overdose incidence in the city of Hamilton. And drug-related emergency department visits, hospital admissions, overdoses, and deaths have sharply increased in the past 5 years. And that trend is mostly attributed to opioid poisoning. The city of Hamilton, the annual number of local deaths due to poisoning significantly increased in 2017 and has remained high ever since. Preliminary data suggests that confirmed opioid deaths in 2020 was 124. And that's the third consecutive year that it's been over 100. So really highlighting the need for continued strong local intervention. What we do know is that equity-oriented frameworks are recommended to better understand and respond to the interconnected social and cultural factors that impact health outcomes for people who use opioids, especially those experiencing systemic inequities, unique vulnerabilities, and structural violence. And that's really where the challenge comes in, to help us really understand what are the specific needs, experiences, and barriers to opioid-related care facing those most at risk. Health Canada and Public Health Ontario have identified groups that often have unmet needs from the existing substance use programs. And those groups include Indigenous peoples, racialized peoples in communities, women, Two-Spirit, LGBTQ plus people in communities, people facing housing insecurity and homelessness, and youth. And understanding the unique needs and challenges experienced by these groups is essential for us to create effective local programming. Additionally, I recognize that that's a lot of groups, and that the scope of the project probably could be just one of those groups, and we're open to negotiating and rethinking how the project scope or the target population could be made feasible as we move forward.
Yeah. So Health Canada and Public Health Ontario have identified those groups, as you're saying. Have they developed any sort of toolkits or methods to help reach these groups? Have the federal, provincial, provinces, governments created resources for the local municipalities to utilize?
There's not specific resources. Now, there's lots of resources around health equity approaches and community engagement and priority group engagement. And I'll say probably not specific to opioids, but Public Health Ontario has done a lot of work in collaboration with the Ministry of Health at providing resources. They have some training modules. They have health equity impact assessment tools and data collection guidance documents. And they have data analysis snapshots, just so that there's background data available. But I would say that significant tools have probably also been created by the National Collaborating Center for the Determinants of Health and the Ontario Association for Healthier Communities. They both have some resources and toolkits related to the principles and best practices and frameworks and webinars and guidance for data collection methods, including focus groups and surveys. We would be happy to share what those resources might be, but I'll also add that we would be open to creative solutions. I think there's really might be an opportunity here to look at things that we've done surveys in the past, and we're looking for that maybe more experiential input. So we're open to creative ideas for data collection.
That's wonderful. Going back to the equity-oriented framework that you're proposing, are there other municipalities that you know of that are using equity-oriented frameworks for similar health crisis responses?
I'd say that the importance of health equity has really been highlighted in the COVID-19 pandemic response. And really that's the catalyst for us wanting to dig deeper. What we've seen through the pandemic response is that obviously different groups have experienced different challenges in accessing both care and vaccine. And that the different supports are needed. They're fundamental to the success of any response. And so the data collection and reporting being used to inform tailored responses in Hamilton has really been a successful approach, in particular for vaccine distribution, where they've actually made some headway in bringing up equitable access to vaccine. We also know that best practice for municipal drug strategies is to hear the voice of the people who use drugs and integrate that voice and perspective into program planning and program implementation. Different drug strategies, I think, across the province have used different strategies such as advisory boards, surveys, seats at planning tables, community consultations. And prior to the drug strategy being put on pause, we really did have a lot of people with lived experience integrated into our planning tables. But we know that places like Ottawa have also engaged in broad community consultation with people with lived experience, and Toronto has specifically created an Indigenous overdose strategy. And there's some additional research out of Toronto about specific barriers that women have experienced, and there's some published articles on that just recently came out. And I know there's probably a lot more in terms of equity frameworks, and we could definitely investigate that further. But I would say there's probably two real reasons why this it's important for us to sort of move forward locally, and that would be, as I previously mentioned, COVID-19 has really changed the context of both drug supply and drug use and services. And so we think it's important to get an insight into those changes directly in our community. And there's no real one size fits all. And it's important that we assess and address within our actual populations so that we can actually make something that's tailored to the things that are happening in Hamilton. And I think the second thing is that it's important to have rigorous methods applied for this. To be honest, we're still stretched quite thin in terms of resources. And so we really do need some help. We need some partnership to help us move forward. And we really do want to look at something that is robust and unbiased.
It's interesting that you bring up the vaccine rollout, because I was also thinking that as you're talking about how to reach these different groups, and I know that they did a lot of work trying to reach those communities. So maybe using some of the research that has been done and the strategies that they deployed to do that rollout could be applied. That lens could be applied to this project as well. I know that this is coast to coast, an epidemic that's all communities are facing in some degree, but I'm wondering if you have any insight into that spike. Is there something that happened around 2017? Are these just natural ebbs and flows of drug use that happens? Do you have any insight there?
I really wish I knew the answer to that. If it was something that we could just go, yes, this is the cause, and we'll take it away and we'll solve the problem. But it really is, there is no one cause to the opioid crisis. And we do know that, broad exposure to highly addictive opioids throughout North America for a long time, and that coupled with this current manufactured supply that's volatile and unpredictable has led to this increase in overdose, and in particular when the user doesn't know the potency of the drug that they're using. That's really what we're seeing.
Right. Yeah, there's no consistency to what it is. So maybe we could talk about what the specific deliverables that you are envisioning from a student group. Do you have some examples of what you're hoping students could come up with, some specific project objectives?
I think, like as I mentioned, I think really hearing the voice of of users and what barriers they're facing, what's their needs, what's their experience, and as I said, I think something we're open to creative storytelling approaches or qualitative research in that regard. But it is something that gives us not just quantifiable information about what's happening, but some information about where we can make some improvements.
There's a lot that can be done with that, for sure. Well, thank you so much for joining us today. Is there anything else you'd like to add about the project?
No, I'm excited for this opportunity, and I really hope that we can find a match.
Wonderful. All right, thank you so much.